Hearing
by Emily Gevins,
Megan Brady,
Courtney Maurer,
Jessica Wall.
The ear has external, middle, and inner portions. The outer ear is called the pinna or helix and is made of ridge-like cartilage covered by skin. Sound funnels through the pinna into the external auditory canal, a short tube that ends at the eardrum or tympanic membrane. Sound causes the eardrum and its tiny attached bones in the middle portion of the ear to vibrate, and the vibrations are conducted to the nearby cochlea. The spiral-shaped cochlea is part of the inner ear. It transforms sound waves into nerve impulses that travel to the brain. The fluid-filled semicircular canals attach to the cochlea and nerves in the inner ear. They send information on balance and head position to the brain. The eustachian or auditory tube drains fluid from the middle ear into the throat behind the nose.
Sound waves passing through the external acoustic meatus strike the tympanic membrane, causing it to vibrate. This motion is transferred to the malleus, incus, and stapes in a stepwise motion before pushing against the oval window with the same force. The movement of the stapes against the oval window displaces a perilymph within the scala vestibuli, creating a wave from the basal end to the helicotrema of the cochlea. When stereocilia bend towards a single kinocilium comprising hair cells, a graded depolarization excites the afferent cochlear fibers, which in turn send signals to the brain at a higher rate. This action occurs in the opposite direction upon repolarization when the stereocilia bend away from the kinocilium. The extent to which cochlear hair cells are excited allows for the frequency and loudness of sound to be interpreted. Low-frequency sounds cause a greater disturbance, resulting in a larger fluid displacement. High-frequency sound waves travel a shorter distance because they are conducted through the perilymph of the scala tympani, vibrating the basilar membrane. Multiple tones are heard when various hair cell locations are activated. The loudness of sound is interpreted based on the extent to which the tympanic membrane, ossicles, oval window, and cochlea are vibrated. Louder sounds create a greater vibration, resulting in a larger displacement of the basilar membrane and hair cells, causing more neurotransmitter to be released in comparison to softer sounds.
Movements of the hair cells in the spiral organ cause an electrical impulse to be initiated and sent down the vestibulocochlear nerve. The impulse then travels through the spiral ganglion. Once there, it synapses and travels to the cochlear nuclei in the medulla, which then travels to the superior olivary nucleus. This is located between the medulla and the pons. The lateral lemniscus brings the vestibulocochlear nerve to the midbrain, where it reaches the inferior colliculus. This is the auditory reflex center of the brain. The midbrain then sends the nerve up to the medial geniculate portion of the thalamus, where it will then be interpreted and possibly saved in the brain. The interpreted sound is then sent to the primary auditory cortex, where one is made consciously aware that they are hearing sound. Sound will be more resonant on one side than it is heard from the other, but it is also distributed to both temporal lobes. Depending on the sound, reflexes are then initiated.
Conduction deafness is caused by sound not conducting from the middle ear to the outer ear efficiently. Earwax or perforated eardrum can impede sound conduction from the eardrum to the ossicles. Other possible causes include otitis media and otosclerosis. Conduction deafness can be treated surgically. Sensory neural deafness is the most common type of permanent hearing loss. It is caused by damage to the neurostructures in the ear such as cochlear hair cells and cochlear nerve. Hair cells can be easily destroyed by the exposed to high-intensity sounds from the airports or a rock concert. Age can also reduce the number of cochlear hair cells as well. Other causes include stroke and tumors in the auditory cortex. Most of the time, sensory neural deafness cannot be surgically corrected. Tinnitus is more of a symptom than a cause. It can result from inflammation or reaction to a drug like aspirin. It is an early sign of sensory neural deafness.